This is opportunities and initiatives to protect health and the environment of children, collaboration in research and policy. And we're very pleased to welcome Dr. Ruth Etzel back to Alaska. She's a longtime Alaskan. She is now the director of the Office of Children's Health Protection at the EPA. So welcome, Ruth. Kimberly Gray is joining us remotely from the National Institute of Environmental Health Sciences. Kim is the Scientific Program Administrator for the National Institute of Environmental Health Sciences, Population Health Branch, and she'll be joining us by Skype. And we think that we have this technology working. We're also very pleased to welcome Nica Louie, also from the EPA, National Center for Environmental Research, and she manages the EPA and NIEHS Children's Environmental Health and Disease Prevention Centers. We're very pleased also to welcome Maureen Swanson, who will be demonstrating her beluga and moose calls that she's been working on since she's arrived in Alaska.
I'm determined to see a moose and a whale.
She's been practicing very diligently. Maureen is with the Learning Disabilities Association of America, and she is also the co-director of Targeting Environmental Neurodevelopmental Risks, Project TENDR, which released a very important scientific consensus statement this past July that was published in Environmental Health Perspectives. And we'd also very much like to welcome Nsedu Witherspoon, who is the executive director of the Children's Environmental Health Network, and she brings so much experience in policy and research for the benefit of children everywhere. So this is an incredible panel, and we just thank all of you.
Good morning, everyone. Pam calls me a long-time Alaskan, and she's actually fibbing, although I have a long-time love of Alaska. Is it working? I might need help with this. Can you still hear me now? Yeah. Okay. I have a long-time love of Alaska, but my knowledge is not nearly as deep as the wisdom you heard in the first panel. That was awesome, wasn't it? It was just fabulous, and I'm actually humbled to be here because I have a tiny bit of wisdom to impart compared to what we heard this morning. I do have a love of Alaska, though. I came here as a very young medical student in 1980 to work in the old hospital in YKHC. Anybody of you remember the hospital they had before the Yellow Submarine? So I learned my first baby steps in medicine and in pediatrics in the pre-Yellow Submarine hospital. And then when I was in my training, I would come back every winter because many of you probably remember Ron Brennan. So Ron was my mentor out in Bethel, and he, of course, runs dogs. And so every January, he'd say, Ruth, you got to come up for January. I can't do pediatrics. I got to run dogs. And so I would come up just for the month of January, work in YKHC, and Ron would prepare for his next Iditarod. So I hear that Ron just retired last month, and to me, it's a big loss for Alaska Native children because he did such a great work out in YK and when he moved to Anchorage as well, in taking care of kids with all kinds of different illnesses and disabilities. And so that's when my love of Alaska started. And then I actually came back to Alaska full-time to work at South Central Foundation back in the year 2001. And for about 7.5 years, I was the research director for South Central Foundation. And that was wonderful fun, and actually I maintain a lot of good friends there as well. But now I work at the Environmental Protection Agency in Washington, D.C., and I only get to make short trips to Alaska. But it is a joy to be here, and thank you for the invitation. So I wanted to talk a little bit about what the Environmental Protection Agency is doing to protect children. Children here, children in many other parts of the country, because we believe children are the most vulnerable to environmental contamination and need special protection. And what I'd like to talk about is just a little bit about their differences. I think most people in this audience probably appreciate that, but I wanted to be sure we cover it in case you don't, which is that children have quite different environmental exposures than adults do. They are physiologically different from adults, and they have certain windows of vulnerability when their brains and when their lungs are developing, when an environmental insult can have a particularly nasty effect. And they're different in a number of ways. Proportionately to an adult body size, they breathe more air, they consume more food and water pound per pound than adults do. They spend more time outside, sometimes exposed to different things because they're at ground level. And they're, of course, ingesting dust and dirt and feral Cheerios from all over the place. And so they have a lot of things that get into their mouths that don't get into the mouths of adults. And just recently, we've begun to recognize that the environmental hazards that affect children compound the other hazards that they are already facing, the hazards of poverty and malnutrition and stressful circumstances. And so we need to look holistically at all the bad things that may be happening and try to make a more healthful environment for children to live and to thrive in. The EPA has a number of things that we've done in Alaska in conjunction with many other partners, including partners in the Rural Alaska Children's Environmental Health Initiative, working to create specific tools that will help, for example, tools for school environmental health assessments. We've worked on training and outreach on children's environmental health. We've got partners at ANTHC who work with us, especially on issues related to air pollution, and we'd like to do more. We lead the Rural Alaska Dust Work Group, and there are some funding opportunities that come available to communities through that Dust Work Group to get funds for issues of importance to children's environmental health. And we continue to emphasize that there's a lot more to be done in Alaska, as everyone in this room knows. We need to do more on water and sanitation because of the links between respiratory and skin infections that are associated with lack of in-home water service. We know that indoor air quality remains a pressing concern throughout Alaska. We want to work together with communities to really focus on mold as one of the issues that can have a really detrimental effect on children's environmental health. And in the outdoor air, we continue to work on issues related to smoke and to vehicle exhaust, as well as solid waste and open dumps that can be places for children to become diseased. But I want to talk more about things that need more attention. And what we believe needs more attention nationwide is the fact that we're having an epidemic of chronic diseases among children in this country. We know that rates of developmental diseases among children are increasing across the country. We know that many children are affected by asthma, and we see rising rates of obesity as well. And there's every indication that a mixture of factors, including industrialization and urbanization and poverty and inequity, as well as things like climate change and deforestation, are all contributing to this epidemic of chronic diseases that we're seeing in children. And they're more vulnerable, and they're suffering, and they're the future. And so we, together with ACAD and all the partners in this room, are eager to find ways to take action to stem this epidemic of chronic disease among children. Now, I come from the medical field. I'm a pediatrician, and so when we talk about this, most pediatricians will say, well, we're doing so much better with childhood cancer. And in fact, it is correct. The 5-year survival for children, shown here on this slide by year of diagnosis, has dramatically increased. And so children who get cancer actually often survive. The rates can be higher than 80% survival. But what I'm worried about is that we see a steady, slow increase in the incidence of childhood cancer in this country. Here you can see data from 1973 through the most recent data that NIH provides for 2012. And you can see that this is an upward slope of all cancers among all children from 0 to 19 years of age. We would like to find a way of stemming this upward increase in childhood cancer. And there's some evidence that toxic chemicals in the environment can contribute to the chronic disease epidemic that we're seeing in this country. And we know that there's growing evidence that there are environmental links to childhood cancer. For example, the links with radiation are very clear-cut. The links with solvent exposure, especially exposure to benzene, are well understood. We know that parents' employment in certain industries, such as industries that use solvents like painting and printing, can be a risk factor for the development of childhood cancers. And we know that some pesticide exposures, especially prenatally can be a risk factor for the development of childhood cancer. So before I came to EPA, I worked at the World Health Organization, and one of the big issues facing us at the World Health Organization is trying to make estimates of how much disease could be prevented if we actually could modify our environment. And so I'd like to share with you some of the data, not so much from the United States as much as worldwide estimates that the World Health Organization made to try to answer the question of, if we could get rid of air pollution, water pollution, food pollution, how much good would it do our health? And let me tell you how they went about this work. The first thing that they did was they had a very constrained definition of environmental health. Included in this definition were, of environment, I should say. And under the World Health Organization definition of environment, we see things like air, water, and soil pollution, radiation, noise, occupational risks, the built environment, climate change, and hand washing. But on the right-hand side, you see many things that some of us do consider environment, which WHO decided to exclude from their analysis. Things like exposures to alcohol and tobacco and drugs, things like diet and bed nets and unemployment and natural hazards and person-to-person transmission of any disease. So we consider this to be a rather conservative estimate of environment. And here are the results. WHO divides the world into many different regions, and for the purposes of this graph, just know that these are the WHO regions. But the thing to look at is the world average, which is 24%. What this means is that if we could clean up our air, our water, our soil, our food pollution, WHO tells us that about 24% of diseases would go away. Now, wouldn't that be fabulous? And shouldn't that be what we are aiming for? Excuse me. Well, EPA believes that in order to work on these issues and in order to make better links between health and environment, we actually need to make better connections among people about how environment is affecting our health. Because many people don't really fully understand that environment is one of the determinants of health. And so EPA, in conjunction with our partners at the Agency for Toxic Substances and Disease Registry, funds pediatric environmental health specialty units. And there's a pediatric environmental health specialty unit in Seattle that serves the Alaska area. And I know you guys have interacted with them. They're a powerful force for good in pediatric environmental health. We also have them in 9 other units, and they work together as a network to bring information to clinicians and others who often don't have a lot of background in how to deal with children who are having problems because of the environment in which they're living. And WHO is also playing an important role in this because they realize that training of doctors and nurses is so important. And they've developed extensive training packages that are peer-reviewed PowerPoint modules in order to help doctors and nurses with all the questions that they get from parents. Because often parents come in with really good questions and the physician has no idea how to answer them. The work that EPA and WHO are doing is to try to better prepare clinicians for the questions that parents and communities have. So what are parents worried about? Here's a whole variety of things that parents in the lower 48 told surveyors that they were interested about. And about midway through, you can see environmental pollution. 47% of parents in this survey of about 1,000 parents said that they were worried about environmental pollution. And yet, we don't prepare the doctors to answer their questions. So most of the reason is that doctors are actually pretty hesitant about this field. They're kind of shy about asking the patients in their practice about the environment for fear that they may not know the answer to the question. And this cartoon shows what may happen. They're afraid they might open up a Pandora's box, that the floodgates might come open, and their medical school training hasn't adequately prepared them to know what the next steps ought to be when dealing with environmental health problems in childhood. So it's not only that they're unaware about environmental factors, but they often don't take an environmental history to know what children are exposed to. They may not know how to effectively ask or answer parents' questions, and they may not even know how to diagnose or treat environmental illnesses. And so they often feel like they have minimal control over environmental hazards, and that's often why they don't bring it up with patients in their practice. But we believe that asking is so important. And the reason it's important is asking is the first step to digging in to what is affecting the child's health and to digging in how that might be preventable. And so let's say a patient comes in with a common disease like asthma. There's a whole array of things that the doctor should be asking about and the parent should be discussing with every child who has asthma, ranging from secondhand smoke indoors to moldy home environments, to pollens and ozone and particulate matter. And this should be part of the conversation around every child with asthma so that prevention can be put into place. But clinicians should also consider environmental etiologies even when the disease is not asthma. They should consider environmental etiologies for persistent middle ear effusions, for abdominal pain and constipation, which could be lead poisoning, for headaches, which could be due to carbon monoxide or formaldehyde exposure, for developmental delays, which could well be linked to exposure to lead or other heavy metals, to seizures, skin rashes, and anemia, and the list goes on and on. We believe it's important to dialogue between parents and physicians when children come in with illnesses that could be caused by contamination of the environment. And there are a couple triggers that physicians typically think of. They get clinical suspicion when they see certain illnesses like asthma, that there could be environmental exacerbants, and they often ask. But they should also listen to parents' concerns because parents often know best what their child is exposed to, and it's the duty of the physician to take that parent concern seriously and dig into it with an environmental history. It's most important to ask about certain exposures when the baby is at certain ages. So for example, in the prenatal visit, the parent and physician should talk about the home environment and carbon monoxide, renovations of the home, mold. In the preschool years, to talk about where the children are playing and arts and crafts exposures. And you can see that certain things are more common in summer and winter. This should be part of the conversation between parents and doctors in order to keep kids healthy. So what should clinicians be asking? Well, we have a book that the American Academy of Pediatrics prepared with funding from the Environmental Protection Agency that's called Pediatric Environmental Health. And in that book, your doctor will find a whole series of questions that should be part of routine medical care. Questions about things like secondhand smoke in the home, questions about where the water source for the family is, exposures that they may have from food, and exposures that they may get from parents, occupations, or hobbies. So in summary, we believe that children are more vulnerable than adults to environmental toxicants, and that one important tool that physicians and parents can use is a pediatric environmental health history to start that dialogue between parent and clinician about the various environmental exposures of concern, because this can be the best platform for providing prevention advice. So EPA Administrator Gina McCarthy is dedicated to having people understand that EPA is actually a public health agency as well. Our duty is not only to protect the environment, but to protect public health. And you'll see during the rest of her term as administrator, she will have an increasing emphasis on helping the public and doctors to understand the inextricable link between health and our environment. Thank you very much.
Good morning, everyone. It is such a pleasure to be in Alaska. Since my plane landed yesterday afternoon, I have felt the spirit. I was saying I think it should be illegal to take pictures because it just does not convey the spirit. And of course, the opening session that was set up conveyed the same spirit as well. I'm also thrilled to represent the National Center for Environmental Research as a project officer managing the NIEHS and EPA Children's Centers program. And of course, the real champion, Kim Gray, who has been protecting and really nourishing this program, will be speaking now after me. These centers have, let me gather my thoughts. Yeah, so the centers have been funded by EPA and NIHS now for 17 years. And we live in this changing and challenging world, which, as alluded to earlier, we live in a chemical soup, and our budgets are being threatened and cut. And so we have these setbacks, and in light of this, providing a healthy and sustainable future for our children becomes more and more of a challenge. And it's something that nags at me personally daily as to how can I personally do my job better so that we can ensure a better future. I can always find fault with others, but really, I need to focus in on myself and think, what can I do to make the field move forward better and quicker? Ooh. So I wanted to just put things into perspective, as Ruth said. Gina McCarthy always, when she speaks, our administrator, she says, you know, the EPA is not just for the birds and the bunnies. We are a public health agency. And within the EPA, the Office of Research and Development, our goal is to really provide the science and support the research that can promote the agency's mission. And at NSER, what we do is we fund the extramural research that goes on to be able to support the agency and, of course, environmental health. And this map gives you a quick snapshot of the 2014 funding that we did, and it shows you that we had more than 500 STAR grants, and STAR stands for Science to Achieve Results. And at EPA, what is really key is the fact that the research needs to end up benefiting the community, and that it doesn't end up as a file saved somewhere. So about $300 million of STAR funding for 2014. And I wanted to touch on the tribal program that we fund. In fact, a couple of weeks ago, we had a grantee meeting in North Carolina where we brought together the current grantees. And the spirit reflected what I sense here as well. There was a reflection on the spirit, and there was a reflection on the chemical contaminants, and there was a sense of community, and this whole addressing of your families being left behind, and this whole sentiment that I feel was reflected there as well. This program has been funded since the year 2000, and $11 million have been invested. There is a report that was put together that's available on our website, and I can send links to anyone who's interested. But the research addresses the lifestyles and practices, the communities, and the occupations and environmental releases that may significantly impact the tribal community. And so the research is conducted on tribal lands, and it is conducted by either researchers from the universities or with the universities that are tribal colleges and universities, as well as the tribal health organizations. In fact, the picture here is from one of the grantees. I'm using it with his permission. If you look to the left, you'll see the cot, the fold-away bed for the child. That's in this set-up tent when they'd gone on a hunting exhibit. So this map shows the centers, current and former. And so there's a network of experts that have been developed across the country for the past 17 years, and the aim has been to collectively look at the environmental factors that impact children's environmental health. And with about $300 million spent or invested by both agencies combined, and almost 2,500 publications these centers have really established children's environmental health research and have brought it to the front of our discussions. They've built a critical mass of experts, which I think is key. Scientists, they've trained many researchers, worked within and with communities, added new cohorts, and formed many robust community partnerships. And they have also provided sound regulatory evidence, which I will be speaking to in the next couple of slides with a few examples. This is the organophosphates chlorpyrifos story, and I won't go into the detail, but this slide, which was adapted actually from Linda Birnbaum and probably Kim, shows how an experiment started by one of the centers, the Eskenazi Center at Berkeley, which was linking prenatal exposure to organophosphates, resulted in impact at a regulatory level. So when 3 of the centers, Mount Sinai, Columbia, and the UC Berkeley Eskenazi Center, published their independent papers at the same time, it was on the nightly news, which for environmental health, that's really big. It was on the ABC nightly news. And so they were awarded, EHB awarded them a Paper of the Year award. And, you know, the Food Quality Protection Act, the 10X factor, is something, it's an ongoing saga, but EPA has been considering. They've added that back in for evaluating exposure for children. And additionally, if we take a step back, we'll see that, in fact, in 2007 in New York City, a landmark bill was passed that required buildings and schools to use IPM, integrated pest management, versus going in and just spraying the buildings. All of these things were coming about as a result of their research. And in fact, as of just this year, the EPA strengthened the worker protection standards for pesticides to be finalized January of 2017. For the first time, there will be, there is going to be a minimum age requirement for handling pesticides, so those under the age of 18 will not be able to handle the pesticides, and that's pretty remarkable. Another fantastic example is for arsenic. So when the Dartmouth College Children's Center published in 2011 that they had identified rice and organic brown rice syrup as a potential source for dietary arsenic, Consumer Reports took over. They started testing all sorts of other products. They published it. As a result, it started an extensive study by FDA. And in the meantime, products containing those geared towards children started being pulled off the shelf voluntarily. Additional research continued, and the Dartmouth Center demonstrated that 80% of the infants were introduced to rice cereal in the first year of their lives, indicating that the total urinary arsenic concentrations were twice as high among infants who ate rice compared with those who didn't. The highest urinary arsenic concentrations were seen among infants who ate baby rice cereal. And then in March of 2016, just this year, FDA completed their risk assessment, and they estimated that approximately 6% lower chance of developing lung or bladder cancer over their lifetime if infants were not fed rice or rice products, which is, of course, developmental origins of disease. I mean, so if you're not fed something and you're setting a trajectory. And in April of 2016, FDA proposed a limit of 100 parts per billion for inorganic arsenic in infant rice cereal. And I just wanted to say that, while I focused on 2, there are other stories. The California Air Resources Board emission reduction plan for ports and goods movement cited studies from our USC UCLA Children's Center, which had showed a reduced lung capacity from exposure to air pollution. Another success story is EPA's decision to ban ACE and phos-methyl, the pesticide, in 2012, and that was because of work from the University of Washington Children's Center. Now, in 2015, one of the dirtiest oils, number 6 and 4, were phased out by New York City, and this was because of work that the Columbia Children's Center had done regarding polyaromatic hydrocarbons and the fact that they can lead to cognitive developmental delays and risk of asthma. And then the bottom picture is from the UC Berkeley Eskenazi Center. They were able to show growers, if workers on the field wear gloves, it doesn't impact the agility and the productivity. So it's now standard operating procedure. I wanted to end by saying that, it has really been the partnership of the centers with the community that has really also had tremendous success. And of course, I cited the things that were happening as far as regulations are concerned. But this picture is from a contest demonstrating the University of Washington. The woman is saying, you are going to wash your clothes yourself separately, and I'm going to go out to a dance, and you leave your boots outside. Speaking about the, exposure pathway. And, just that center alone, they conducted more than 1,500 separate activities in Yakima Valley, and they reached more than 15,000 people. In fact, the grant is wrapping up, and they have been providing feedback, individual feedback to people regarding what they found in their blood and what is going on with them. Even children are sitting in the meetings when they're providing the feedback. One of my favorite stories is from the UC Berkeley Eskenazi Center. And one of the times when Brenda Eskenazi was at one of the events in the community, and I must say that they have done more than 540 presentations in the community during the life of their grants. One of the dads came up to her and said, "You're the reason why my child will not hug me when I go home." And I wanted to thank you for that, because we weren't aware of the exposures. And because of you, now we know. So I end on that beautiful note. And here is a list of all the different opportunities for grants that's available at Ensor, and I'll be happy to email it to everyone. That's it.
Okay, I can hear you. And everybody can hear me okay? Okay. I'm going to do this hands-free. Okay, you got the first slide up? Okay, so thanks everyone for your help and letting me stream into your meeting. I wish I could be there in person, but I'm not allowed at this time, but maybe in the future. I've worked with Vi and Pam in the past, and really take these issues to heart, especially in these vulnerable communities where we don't have a lot of our outreach efforts, and we wish we could be there. And although we can't, we are definitely going to be here to help. So go to the next slide. So this is our slide about why environment matters. I don't have to preach to the choir here, but it helps us that we have data to support why environment matters. We know that 13 million deaths can be prevented by improving our environment. We know that environmental factors influence 85 out of 110 non-communicable diseases, and this was in the WHO report. This really helped raise the visibility of our efforts, along with EPA, that the environment is really important to consider when developing prevention programs. And we know that environmental factors account for at least 2/3 of the cases in the United States alone. So As Linda likes to say, you can't change your genes, but you can change your environment. Next slide. So issues of why children are important to us, but they're not as healthy as they used to be. So we know that 1 in 6 children in the US have a developmental disability. And we know this has actually significantly grown in the past decade by about 17%. And that 14% of our children are under the age of 18 have been diagnosed with asthma. And that 32% of our children are considered overweight or obese in the last assessment at 2010. And nearly half of our children now are allergic to something. And I think we all as parents can relate to that. So next slide. Lots of data on what moms are exposed to. We have the body burden showing that there's over 287 chemicals found in our cord bloods, that 47 chemicals are present in every pregnant woman tested, that our breast milk is contaminated. And of all the people that the CDC tests within the NHANES assessment, all of them have presence of BPA, phthalates, triclosan, PCBs, as well as these airborne contaminants from also known as polyaromatic hydrocarbons. Next slide. So what's the significance of the cohorts that we've been building at NIHS and EPA, and what do they help us really address in children's health? Well, by understanding the effects of these exposures on children's health, it's one of our biggest priorities. Following the populations over time helps us understand not only the individual effects, but the synergistic effects and of these environmental exposures on pediatric outcomes like birth outcomes, respiratory outcomes, neurological, and now we're looking at metabolic outcomes in these children. Next slide, please. Now, since Nica gave you a wonderful overview of the children's centers, brief but good, I'm going to just show you where our strategic plan sits and the mission of our institute and how children's health fits in that. So the mission is to discover how the environment affects people in order to promote healthier and happier lives. We have these mission boundaries of community engagement, training and education, our fundamental research, our exposure science and translation. And children's health falls into this goal too, which touches upon individual susceptibility across the lifespan. And next slide, please. One of the flagship programs that was developed in another collaboration similar to the EPA collaboration, the Children's Centers, is BSERP. And this BSERP characterization is really looking at where the Children's Centers is focusing on the prenatal and childhood. This was focusing on the early adulthood, early childhood transition to puberty. And the characteristic of it was really to look at environmental exposures across this window of childhood, early adulthood, and premenopause, to look at what are these environmental exposures that may be linking us to breast cancer specifically. And we kind of back the window of exposure up to look at pubertal development. And what are those environmental factors that could be contributing to early puberty? Because as we know, early puberty is related to is an early risk factor for breast cancer. Next slide, please. So in this collaboration, the BSERP collaboration, we found many interesting insights into the onset of breast development in younger girls was related and strongly related to BMI. We found out that high molecular weight phthalates were associated with pubertal development, as well as our retardants and our other persistent organic pollutants were associated with changes in breast and pubic hair development. And really what this was suggesting is there were things that were delaying puberty, there were things that were accelerating puberty depending on the populations we were studying, so that we knew that environment was having an impact here. And we decided that within this program, like the Children's Centers, we really developed meaningful messages that were needed for kids because we wanted to start really early, working with the mothers and the young daughters who really wanted the messages about what the scientific detail was about, but they wanted us to present it in a more readily friendly format that included really explicit details about the explanation of the findings. Next slide, please. And in the same kind of program, like the Children's Centers, like the BSERP, NIH and EPA developed the Centers for Excellence on Environmental Health Disparities Research. Next slide, please. The program goals of this were really to look at the mixture of basic and applied research, develop capacity to expand the stakeholders' participation in the research, and develop methods to integrate multiple factors, both those chemical and non-chemical stressors, to look at environmental health disparities. And another core aspect of this program is to disseminate the knowledge that's culturally appropriate and that will benefit affected communities. Again, we were hearing from our stakeholders that this translation of the message needed to be appropriate. Next slide, please. This is just a quick slide of who we funded. And two of them have a focus in children's environmental health, and that's Frank Gillen at USC, as well as Johnny Lewis at New Mexico. And these programs, although new, are really a nice program to kind of demonstrate how NIH and EPA have built these collaborative efforts to really address some of our vulnerable populations. Next slide, please. The next one I'd like to share with you is the CHEER program. Now, this just started at NIHS last year, and it is open for applications. It is a established laboratory analysis program for environmental exposures, as well as data analysis consultation at no charge to investigators. There's an application process where you go online, and if you have a cohort that hasn't had environmental exposures added to it, we look at your application, make sure that you have the right approvals in place and you're asking the right question, and we're providing that analysis for you. Next page. This gives you a quick, brief summary on the left of everybody who's funded as a lab, the targeted and suspected analysis of what we think the communities will be asking us to analyze for them, from metals to PAHs, all the way down to flame retardants, hormone panels, and nutritional factors if needed. This will provide access to state-of-the-art infrastructure for analysis of all biological samples, as well as understanding the biological response associated with those exposures. These labs are conducting targeted and untargeted analysis, and also will do the data analysis for you as well. Next. So in order to really start creating an opportunity for collaboration, NIEHS created a catalog of all of its funded epidemiology studies. This is going to give a really nice internal and external picture of what we fund, who we fund, and also this database will help folks understand the science we fund and also where there could be potential collaborations. Next, please. So facilitating the collaborations, it maximizes our investment, and it really does provide the junior investigators and new researchers to a path to find and initiate ancillary studies. Next. It has a phased approach. Right now, it's a fixed searchable table, and it just shows a snapshot of the resource itself, the catalog, where you can look and see, I think this is slide 17. Gives you an idea of what we fund, who we fund, and you can really look up location and exposure of interest, as well as outcome of interest. And we really hope to get this online where you can query it by entering other terms and getting really deep into the data on linked studies as well. Next slide, which is next steps in advancing children's health. So what we're here to do at NIHS is really to promote the use of CHEER to help add environment to children's health studies, as well as implement that exposome concept of looking at biological response. We're enhancing the inventory of existing birth cohorts so that we can add additional detail and link grants. We've created what's now on a funding opportunity, a program to maintain environmental health cohorts, as well as require the sharing of that data externally. And then we're really taking an active role in supporting of a new effort at NIH called ECHO, Environmental Exposures and Children's Health Outcomes, and that'll be another talk later. And then really we need to focus on sustaining our environmental public health communication with our stakeholders and provide support for community outreach. Next slide. We all know that community outreach and engagement is essential. It's in addition to understanding how these exposures affect children's health. They also work to inform the general public of environmental hazards, and we reach out to the community to explain how certain chemicals can affect child growth and development. Next slide. So I just wanted everybody to know about our this is slide 20, Partnerships for Environmental Population Health. This is a way that we can provide multiple ways for researchers and community members to obtain support and innovative creative activities within our network. Next slide. We have communication strategies. We have a resource center, which has materials, and users who come to look at our materials can search through these materials and find pamphlets as well as and tools to use for their research studies. We have a monthly newsletter. We have more than 26 released podcasts. We have monthly webinars, as well as highlight grantees in our news and have an active Twitter page. Next slide. And this has multiples. One of the really interesting things that we've done here is have an environmental health podcast. And in episodes, it really highlights the way that the communities are working in partnership with the institutions and looking at health issues to address at a local level. The podcasts are short and sweet. Topics include things like asthma, prenatal exposures, hydraulic fraction, and they're all available on iTunes. You can keep going through to slide 23. Is it showing? We've just found out that we were considered one of the most 45 awesome podcasts for public health. We were ranked at number 4. And Liam O'Fallon should take all the credit for that. He really does an excellent job of outreaching and networking this resource that has been developed. Next slide. And then finally, our Research to Action program. This is the one funding opportunity that's out on the street that we continue to use that really brings together the community members and the environmental health researchers to investigate a health risk that's really important to the community. It requires that community and institution collaboration. It requires action, and then there's an evaluation at the end. Next slide. So what I have to say here is that prevention is key, that we need to educate ourselves and others about the major concerns of our children: air pollution, pesticides, metals. We have to ask the parents and their families about their exposures. And we know that we need to encourage healthy diet and weight and stress management for families and children, and that we need to counsel our parents and our parents-to-be to avoid and reduce relevant environmental exposures. And last slide, please. And I welcome anyone who can attend. We will have some live streaming of this event, the Environmental Health Science Festival, to kind of end the celebration of our 50th year at NIHS. It's December 6th through the 8th. So if you can, take a look at our website. There's going to be films. We're going to have some sensor development. It's really an exchange of the science between the communities, the stakeholders, and the scientists. And we hope you can join us in the celebration. And thanks again, and thanks for all. Sorry about all the technical difficulties, and I wish I could be there.
Hello, I'm Maureen Swanson with the Learning Disabilities Association of America. I'd like to thank Pam Miller and Jesse and everybody with ACAT for inviting me to be a part of this wonderful conference. It's truly a privilege to be here today. I'm not going to share my moose call since I understand the bull moose are aggressive this time of year, and so they would all come running. Well, as I said, I direct children's environmental health initiatives for the Learning Disabilities Association of America, and I co-founded and co-direct Project TENDR, which is targeting environmental neurodevelopmental risks. And my co-director is Dr. Irva Hertz-Peixoto, who is an epidemiologist and professor at the University of California at Davis. And Project TENDR is really I like to think of it in a couple different ways as a breakthrough in terms of the alliance across sectors and the agreement on the science and what it says and the action that it calls us to take. Project TENDR is a group of almost 50 environmental health scientists, health professionals and medical organizations, government scientists, and children's health and environmental advocates. And that alliance is really well represented here today. Today, Pam Miller, Carol Kwiatkowski, Kim Gray, Nsé Witherspoon, Charlotte Brody, Elise Miller, Katie Huffling, and Janet Mon are all part of Project TENDR, and Brenda Foos from Ruth's office at EPA is also a participant in Project TENDR. So that's subsection of that alliance that we have brought together. And Project TENDR, again, I see it as a breakthrough in terms of these different sectors coming together and reaching an agreement on the science, that the scientific evidence is at a tipping point. And, you know, I think of what Lisa Wade said this morning about always being asked for more research and more evidence and more proof. And while it's extremely important that NIEHS and EPA are funding and continue to fund this research that is so critical to helping us know more and take action, in Project TENDR, these scientists and health professionals and advocates have come together to say, we know enough. We don't need to wait for more research. We know enough. We know enough to say that toxic chemicals are harming our children's brain development and that it's time for action. And specifically, multiple studies conducted on a wide range of diverse populations have repeatedly demonstrated that toxic chemical exposures, especially during prenatal development and in early childhood, that those toxic chemical exposures are contributing to problems with brain development and learning and behavior and attention issues. Those disabilities and disorders affect 1 in 6 children in the United States and are increasing, especially we have increasing rates of autism spectrum disorder and ADHD. And I wondered if, just with a show of hands, how many of us know a child with autism or ADHD or a learning or behavior issue? That's almost, I think almost everybody raised their hand. These disorders are way too prevalent and include intellectual disability, and as I said, autism, attention deficits, hyperactivity, learning disabilities, and other impairments to learning and behavior. Now, these are complex disorders. There are many factors. As we heard this morning, our speakers talked about the many different factors that come together and combine, including genetics, nutrition, social stressors. But what we're saying in Project TENDR is the contribution of toxic chemicals is a part that we can do something about. We can prevent that piece of the increasing risks for these disorders. And can I go? And so our mission with Project TENDR is to reduce exposure levels of these chemicals or pollutants that are contributing to the risks for neurodevelopmental disorders as a means over the long term of achieving our public health goal of lowering the incidence of these conditions and protecting our children's developing minds. So how do we do that? How do we achieve the goal of exposure reduction and protect our most vulnerable, which is the developing babies and young children? With Project TENDR, we are taking a two-pronged approach. We have a consensus statement that, as Pam mentioned, was published July 1st in Environmental Health Perspectives. And the consensus statement targets and identifies a short list of chemicals that I'll get to in a few minutes that highlight the larger problem of toxic chemicals affecting brain development. Those chemicals are by no means, the chemicals that I'll identify in a few minutes are by no means the only chemicals that are harming brain development, but they are examples that help us make the problem concrete and provide milestones for success as we work collectively to eliminate and reduce exposures. And then we also say in the consensus statement that the system is broken, that these chemicals that already have harmed our children's brain development and increased their risks are really examples of our failure to protect children. You know, I think of Vi saying this morning that help is not coming fast enough, and it hasn't come fast enough for our children. And so we want to address the systemic problems in our regulation of these chemicals. And I don't expect you to read all those. Those are our consensus statement authors. This wasn't a document that people just signed on to. This is a document that more than 40 experts worked for more than a year to craft every word. And I'll make my slides available so you can see the authors. And then this is a list of some of the organizations that are endorsing the TENDR agreement. I'm including the American College of Obstetricians and Gynecologists, the National Medical Association, the American Nurses Association. So there's our short list of chemicals that we are using and identified as prime examples of chemicals that have increased our children's risks for neurodevelopmental disorders. Lead, organophosphate pesticides, the PBDE flame retardants, which ACAT has done such a leading job of working to reduce the use of those chemicals and exposures, air pollution, and then we named phthalates, which are used in plastics to soften plastics and are used as, they're contained in fragrances and personal care products and cleaning products and cosmetics, and those were named as a category of emerging concern. And as I said, there are many other chemicals, perfluorinated compounds, arsenic, perchlorate, that are also putting children at risk. But we wanted to start with a group of chemicals that we could use to point to the larger problem, for which we have solid evidence of harm and to which our children are widely exposed and to which we also have confidence that we can reduce exposures and protect children's brain development. And then we call for systemic change. And then, I think, again, help is not coming quickly enough. And so the Project TENDR experts were not content. Our first big step was to arrive at and publish our consensus statement and issue a call to action. But now we want to get to work in partnership with many others on ways to overhaul the system and improve our system of identifying chemicals that can harm brain development, and that pay particular attention to the vulnerability of the developing fetus and children, and that enable us to act before children are harmed by these chemicals, that speed the process by finding ways to regulate whole groups of chemicals and not just one at a time, and that end the cycle of replacing one toxic chemical with another, which flame retardants are a great example of that, where you get rid of the PBDE flame retardants, which are carcinogenic and neurotoxic, and then they're replaced with other flame retardants that are similar in chemical structure, Firemaster, 550, and other flame retardants that turn out to be just as bad. And in conclusion, our Project TENDR, our consensus statement, was widely disseminated. It was published on July 1st, and the same day the New York Times ran an exclusive feature story. We had NPR affiliate stations interviewing a lot of our experts across the country. We held a congressional briefing that was attended by 60 House, Senate, and agency staffers, including staffers from Senator Murkowski's office, who are now in touch with us because they'd like to find out more about what we're saying needs to happen to reduce these exposures. And then we had an article that was just published on the TENDR consensus statement in the Journal of the American Medical Association. And I found out on Monday that the journal Pediatrics will be publishing an article on the TENDR consensus statement. So that's all to say that we have a lot of momentum, but we see the consensus statement and this agreement, this breakthrough, as just the first step. It's not an end in itself. And so our experts, our scientists and health professionals and advocates are committed to taking those next steps together. And that's through developing recommendations specific to reducing that short list of chemicals I talked about, to working to propose and help to establish a new process, a better process for identifying chemicals that harm our children's brain development, to continue to collaborate with policymakers and our partners across the country, to provide expertise and influence to the federal agencies that are regulating these chemicals, and to continue, we have another wave of major medical and scientific associations who are reviewing the consensus statement and will decide whether to endorse it or not as another means of disseminating this information and raising awareness. And we intend to continue to engage at all levels. And this conference has been a wonderful example of our TENDR participants helping us to spread the word. And for more information, you can visit our website or talk to me. I'm here both days, and I thank you for your attention.
Good now afternoon. Thank you for your patience with all that was going on earlier. I realize I am in between us and a much-deserved break and lunch, so I'll try to be as engaging as possible, but I definitely want to extend a deep amount of gratitude and appreciation and thanks to Pam, the entire ACAT staff. You guys are fantastic and so accommodating. I've been transitioning back from maternity leave, still transitioning, quite frankly, I think mentally, but while all this was going on in the prep, and the staff has been just so helpful. To all of you, tribal and community leaders, just want to also thank you for your incredible advocacy and your intense work, tireless work every day. I mean, as we all know, it takes more than a village, and I do believe we are going in the right direction, even though I agree it's slow and hard to digest it all. But I'd like to focus in on some work that the Children's Environmental Health Network is doing, and also some other very exciting initiatives and collaborations that are happening that, again, I think are breaking silos and really trying to address the magnitude of the many incredible challenges before us still. My name is Nse. Everyone calls me Nse, but my full name up here is Nsedu, Obot Witherspoon. My background is very multicultural. My father's Nigerian, so he named me. My name is Nigerian. It means expected virtue. And I also can very much relate to the connectivity and the need to be one with your tribe, your folks, your people, nature. So very much feel at home here on my first trip to Alaska. So. I also our office is in Washington, D.C. We are national as an organization, but it's imperative, especially during election year times, and then some, that I keep myself grounded. So I like to start talks and my day at times with different perspectives on children and the value of children, and these are just some of them. I'll read the one in the middle. There can be no keener revelation of a society's soul than the way in which it treats its children, and that's the late Nelson Mandela. So, some of you may know about us. We are a national nonprofit, the Children's Environmental Health Network. We actually got our start out in the Oakland Bay area in California almost 25 years ago, 2017, believe it or not, will be our 25th anniversary. Unfortunately, I wish we were not in existence. I wish there was really no need for us, but there is very much still a need, but there has been progress. Our mission has always been the same from the very beginning, to make sure that all children have the right to a safe and healthy environment, and of course the families and those that support them getting the type of support and nurturing that they need to make those accommodations happen. Our goals to achieve that mission have always been the same, although we do it a little differently at times, but promoting the peer-reviewed research that you have just heard a little bit about here, and moving that into action in training, action in education and building awareness, to then eventually get to the harder parts, but the child protective policy work at the federal and the state levels. We're trying to identify these better opportunities, again, to break the silos. There's been a lot of great work happening in housing and pesticides and specific chemical areas, which is great, and even with specific subpopulations, wonderful. But we do need to find the ways pretty quickly, and there are many reasons why, as we've talked about all today so far, to connect and build our strengths together. We will see better returns in that way. So again, we've seen advances in our research, but we know, okay, there's always much more needed, but there is a lot to move on that we are not moving on. In complete agreement with that. A few policy successes, I would advocate that we've had more at the state levels. It's been frustrating at the federal level for many reasons. There are some federal policies, but I think it's honestly a disgrace that almost in 2017, we still really have no true child protective federal policy in the United States of America. But our states, generally speaking, are moving much quicker, and there's a lot of lessons learned there that I would hope that one benefit of this conference is connecting some of those dots. Some of us can be connecting some of you to other state leaders who are also grappling with some of the same challenges, and some that have had some successes and modeling some approaches there. This number really doesn't mean much. We know there's 85,000 plus. The point is we are inundated, as we know, with many synthetic chemicals due to the way that we do business and our dependency on chemicals in our marketplace and our economy. And we do know that our chemicals, generally speaking, are still not adequately considered and tested for their human impacts and definitely the vulnerabilities of children. So the bottom line here is, as we know, children are still quite vulnerable, and it's up to us as responsible stewards and adults in their lives around them to do much better on their behalf. Ruth talked a lot already, I think, well about the early onset of illness. We're now dealing with more chronic illnesses, not as many infectious diseases as in the past, and many have noted that we are possibly living within the first generation that will see a shorter life than that of their parents and grandparents due to poor health. I mean, these are huge alarm bells ringing around us. Social determinants of health, this is just a graphic that I like to use. I like to look visually sometimes. If you put the child, and I would also offer the family cycle or that support network immediately around that child needs to succeed and thrive and have the nurturing that they need. Here are just a few of the very large factors that have many, many sub-factors underneath them that do impact the health and well-being of a child in a positive or negative way. We cannot work, again, in silos. We cannot just be working on one part of the quote-unquote health scenario without very much acknowledging all these other critical factors with each and every child and the families around them. So getting into some of the work that we've been doing, just a snapshot. In beginning of 2015, we held what's called a Wing Spread Summit, the Johnson Family Foundation in Racine, Wisconsin. It's a pretty big deal where we made the case to them that we have an issue that needed discussion time in a very thoughtful, creative, beautiful space. It's amazing. So a group of visionary leaders came together, and we were focusing on, in this day and time, not 20, 25 years ago, but in this day and time, what are the true priority needs of the field? How do you wrangle an entire field of children's environmental health? As I just mentioned on the last slide or showed you, there's so many things. How do we make the impacts and make them well and prioritize? So we started the beginning stages of what ended up being a visionary statement, if you will, a proclamation. Many of our colleagues and friends here in this room and beyond were a part of that, which then also became the prelude to now the blueprint for protecting children's environmental health that I talk about in a minute. And we really were intentional. There's only 30-some seats in this setting of really bridging the gap between more non-traditional leaders that haven't really been a part of these discussions, urban planning leaders, a lot of legal perspectives, health economic folks, of course, community voices, just to name a few. So in this vision statement, and this is all online, and I'm happy to share other copies after, the gist is the general idea. I won't read it all, but this real proclamation, and it took a while. I really didn't expect that we were going to leave with this consensus, but there were folks that worked almost through the night to make sure that the 30-some folks that came together that day did have a unanimous feeling that this is the rally cry that we all need to be working under. I don't think there's anything in there that anyone would disagree about, but we needed to kind of have that moment that we all could agree upon so that we could then move forward as a field. Here are the critical aspects that are identified as threads. Mobilizing greater societal understanding of children's environmental health. I mean, I'm still boggled. I was at the Hill briefing speaking with Maureen, and when we go to the Hill and do Hill visits, we call it, and we bring the science and the education, I'm still amazed, I guess, with how many of our elected leaders have no clue of some of the issues that you all are hearing about today. No clue, even around asthma, for some basics, or lead poisoning. We still have a long way to go, I think, in some of our education of some basic folks that do have quite an amount of influence. Creating knowledge essential for action and using that knowledge that we have now, which we've been talking about. Marshaling the engine of the economy. I would advocate that we've been doing ourselves a disservice in public health. We do what we do very well. But when we get into the other side of the coin, right, where there's people that for some reason, what we've talked about isn't enough to motivate them to do good, when you start talking dollars and cents, then they really start to listen. We have that story. Increasingly, we now have that story that it is not only a health, economic, and moral and ethical perspective that we're promoting here, but there are many cost benefits that are now being tagged that we can add to our advocacy pieces as we're all out there doing our work. And then building the political will within our government institutions and beyond for child-centered protective policies. So here's what the blueprint looks like. Again, really focusing in on connecting the social determinants of health, and justice and equity are really threaded throughout. We also support research by putting on pediatric research conferences every couple of years. We're a smaller national nonprofit. We could never do it every year, but I'm pretty proud of the fact that it's an opportunity to offer emerging science, especially not only for senior researchers, but for junior researchers coming along the journey here, and also the translation of that science into proactive public health action and protective policies when that can be encouraged. We really do encourage all the speakers to think along that realm. So there's a little something for everyone. And the next one is going to be in DC in the coming April 5 through 7, 2017. So if you can attend, we'd love to have you. And there's a call for abstracts and session proposal abstracts out there now. And we would encourage you letting your colleagues know as well. This is my 6-month-old that will be joining us for the reception later tonight, one of 4. But in other ways, we have a science committee. So we are governed by a board of directors, but we do have advisory committees that help ground us, and they're our sounding board. They're extremely helpful for us as a smaller national nonprofit. The Science Committee is made up of all different government and non-government advocates who we very much respect and need to turn to for guidance and prioritizing in many cases. We offer an article of the month, so we try to take any of the peer-reviewed science once a month and drill it into a user-friendly, what does this mean to me at the end of the day? How can I apply this bench science into my work that I'm doing in my community? It's now been running for 8 years, and it's still one of the most asked about resources online and for our organization, so we won't be getting rid of it anytime soon. We do actually get involved in publications ourselves now, which is pretty exciting. The last 3 years, we've actually been part of peer-reviewed publications and have another one coming out before the end of the year related to the blueprint, which we're excited about. We serve on a variety of advisory science councils, so that is quite an experiment at times, and experience, but it's very important for us to be that child health voice at some of the scientific tables that are determining where money is going and how research dollars are being spent. Here are just some of the boards and councils that I'm currently on. We have on education and training. We have an education committee, again, made of a great amount of additional advocates. I'm a firm believer on a community aspect of doing the work that we do. We have this research tool for healthcare professionals. We actually got our start out training nurses and doctors in the late 80s and into the early 90s. As Ruth mentioned, they weren't really being trained, still are not systematically, I'd say nurses more than docs, being trained in a regular way in all of our schools, nursing and medical schools, on environmental health, but we're getting there thanks to many champions like Ruth and many others. We have we had one of the first training resource curriculums out there for healthcare professionals. We revamped it a year or so ago. It's 12 topical modules, and there's also a user guide. So it's being used for teaching, and it's also being used for information and learning and building awareness. We have all kinds of fact sheets currently translated in English and Spanish, and hope to get to other languages, available for free on our website. And we're launching just next week, Children's Environmental Health Day. This is a day, it's supposed to be a platform. So it's on the frame of this blueprint for protecting children's environmental health, that there's something for every single one of us to do to protect kids. And as I mentioned those themes before, it's under that umbrella. But it's really also a way for us all to take a step back and recognize that there's always more than enough to do. There's probably never enough resources and people to get it all done, but we should be identifying this, taking a moment to celebrate the successes that we have had, the successes of joining together, collaborating effectively, which is very hard to do at times, and more importantly, building our momentum for what the next frontier should be. So again, even though you can't be, there's a DC event happening, but there's a lot of social media activity. We want to let the media be blasted about putting children first, putting families first. And then every October, which is Child Health Month moving forward, the second Thursday of every month will now be deemed Children's Environmental Health Day. So it's also an opportunity to release new tools and resources for the field. And we're encouraging, it's not just for the Children's Environmental Health Network, it's for the field of children's environmental health. And again, we have many of our partners here and beyond that have been great in supporting, and we encourage you all to be a part of that. We also run the Eco-Healthy Childcare Program. Pretty proud of this program. It's been running for 10 years now, even since its pilot stages. It's the only program nationally in the country that's working to train and educate healthcare professionals, owners, facility managers on basic environmental health practices. And we focus on low to no cost steps. We're not gonna go and tell you to, totally fix your leaky roof. Your basic child care standards should be addressing that. We're trying to fill in the gaps where current child care standards are not addressing. And there's no formal mandate in any state right now looking at environmental health measures, unfortunately, but we're slowly getting there. This program is also working with child care licensing and accreditation, so that down the road, as states look at their child care policies, they are starting to consider the environmental components that should be added in a regular way. We also train, so there's a whole train the trainer program function of this. And I know we were in Alaska, our wonderful trainer, the late Carol Strobel, came in a few years ago and did some great trainings in Alaska. So I know that we are here in the state, and if there's any way I can connect you to some of the providers and trainers, I'm happy to do that. And we will have an online curriculum that's coming out on this that will also allow us to reach much further than having trainers go out state to state. And then again, working on child protective policy. So at the federal level, there is what's called the Toxic Substances Control Act, and that's a dissertation in itself with the time that we have. But pretty much this was intended to be one of our most influential environmental health laws that should have been very protective for us. It was supposed to look at the way that we evaluate for health and concern the type of chemicals that are allowed in our marketplace and in our products that we all buy on a regular basis. Unfortunately, it was quickly found out that that was not happening, and it was clear that EPA was not given the authority under this law to really do the work that they had to do. So 40 years into this has been a failed law, unfortunately, but thankfully this last June, a bipartisan bill was passed to reform this bill. We're currently in the process of the rulemaking steps that will then start to be enacted by next summer. It's usually a year from when it's first passed. So it's a very exciting time. A lot of us are working in the public health side to make sure that we're not remiss on the vulnerabilities of children and many others as those rules are being developed. So it's a very critical time for us. And many groups have been working for years on this type of reform. So I would consider that a win. It's never perfect, but I would consider that a win. In clean water, we're working on lead service line replacement collaboratives that have water municipalities with public health agencies, with environmental health agencies. It's pretty exciting. Of course, Flint, the water crisis is one of many. We will see many of these emerging as long as our current water infrastructure is as old as it is. So that just has to change. We can't deal with that anymore. When we're talking about clean air and climate change, we're working with the American Lung Association, a wide variety of other groups like the American Public Health Association and many others on healthy air partners. So we look for when are there opportunities as far as bills that are being introduced when again, we can all insert and be a part of the messaging, public health, prevention, children's vulnerabilities, reproductive vulnerabilities. These are all aspects that we're always trying to look for when our federal legislation is coming down the pike. And many of us were a part of Zika Health Coalition, which just secured some funding finally last week or a few days ago. And that's been a long time coming as well. The fact that pesticides were used a lot in Florida, Puerto Rico, and many other places. And what are the ramifications of that down the road, in addition to the virus itself? So lots to consider there. There are no national standards that exist for assuring that a child care facility is not located on a site that could have been used previously with very harmful chemicals. That's quite unfortunate. There are a few states, only New York and New Jersey, that do have regulations of siting of child care facilities. And unfortunately, like is typical in this country, it's because there was a very awful example in New Jersey, a kiddie college that a lot of kids were getting sick. It's a little child care facility, and come to find out that that land was used as an old mercury plant. These are the type of things that we cannot keep doing, and I know you all know about bad experiences where we don't seem to learn our lesson and make the same mistakes again and again. I'm very excited to announce that next week, as part of Children's Environmental Health Day, the CDC ATSDR is going to be releasing a whole new set of national guidelines for national child care that many of us were a part of. It's not mandated, but it's hopefully getting us closer to some of these type of standards that we critically need to protect children. And we also work with the Environmental Law Institute, so I'm trying to share some of the collaborations here on a report that looked at environmental health policies in states across the country, and how can we overlap that with opportunities in the child care arena, in the early learning, and maybe even the K through 12 arenas. There are some states that do a lot better with child protective policies and then regulation of them, and how do we take that leadership and that momentum and apply it in other policy settings where kids spend a lot of time. I won't go into all of this, but in our, we also work on health in all policies through a CDC cooperative agreement that's just ending this month. And all kinds of who's who's in the child care arena, the Association of Early Learning Leaders, the National Association for Regulatory Administrators, and the National Resource Center for Health and Safety in Child Care, all of them have not only been a part of our advisory groups, but they've been actively working, looking at how can we either create or strengthen current environmental health standards. And these are the who's who of who's setting, standard setting in childcare, and they're considered the gold standard. So it's very exciting to see them learn and then share within their board of directors and their leadership where they should be going as leaders in the field of childcare. There are also some states that are making good strides here. I won't go into all of that, but Pennsylvania, Vermont, New York, California, Minnesota, on and on. Not only are there many states that have been proactive on chemical bans in some of the products, especially in products that are marketed for children and young people, but also looking further at child care initiatives and how they can train child care providers on some of these very important issues instead of waiting for kids to get very sick. I believe this is my final slide. This is a whole list of additional collaborations and partnership. We're all about collaborating. We know we can never do this by ourselves. We won't be even halfway as effective. The Cancer-Free Economy Network, there are many of our colleagues here. This is an effort that's looking at a North Star goal of, in one generation, making sure that the conversation and efforts around cancer in this country are not focused just on treatment, that are also acknowledging the science available that do lead us towards some preventive aspects, and that is actually part of our active discussion and work. Again, lead service line replacement work, radon work at the national level, Project TENDR, as Maureen mentioned, Healthy Babies, Bright Futures, which Charlotte Brody will talk about later. There's an herbicides collaborative we're a part of, where there's a lot of increased projections of using more herbicides in our Midwest instead of less. So again, we still have a lot of work to do on basic education and needs here. There is climate change work, and there are national environmental health public partners that come together and really try to think of, again, how are some lessons learned in certain parts of the country that can be applied to other parts of the country, and of course, in union with our communities and the community leadership and listening to the communities, as we've heard about earlier today. This is my tribe at home, except for the little one. I have 4 little ones, not so little. The oldest is 13 now, but here's my contact information. I really, really do appreciate the invitation to be here with you today.
Well, I would like to thank this incredible panel of wonderful and passionate women leaders for your expertise and coming to Alaska to share that with us, and for all that you do. Thank you again very much.